Thank you.
Order.
Thank you, Mr. Speaker.
Order. I apologise to the member. Order. Order, I say to the senior colleague on my left. There's no need for that. The House has had its fun. Please, I want to hear Barbara Stewart's question number 9.
Okay, thank you, Mr. Speaker. My question is to the Minister of Health and asks, what progress has been made towards implementing free after-hours medical care for under-6s?
The Honourable Tony Ryle.
Mr. Speaker, excellent progress. Free after-hours for under-6s has been operating in Greater Auckland since September last year and operating in the Waikato since the 2nd of June this month.
Barbara Stewart.
Supplementary. Can he explain why details of the funding for the free after-hours care for under-6s, set to begin on the 1st of July, are not yet publicly available?
The Honourable Tony Ryle.
Yes, they are publicly available. I've made comments at a number of occasions that the $7 million being put aside for this is being funded by drugs coming off patent.
Barbara Stewart.
Supplementary. Why have very few rural practices been involved in discussions with their DHBs and PHOs about the extension of the under-6s policy to after-hours care, according to a report published in the latest New Zealand Doctor?
The Honourable Tony Ryle.
That report is wrong. I know that there are significant numbers of rural networks that have been involved in discussions, including Northland, Waikato, Bay of Plenty, Taranaki, Mid-Central, Wairarapa, Nelson Marlborough, West Coast and South Canterbury.
Barbara Stewart.
What does he say to Dr O'Keefe, Executive Director of General Practice New Zealand, who says that the Ministry's guidelines for the implementation of this policy do not address matters such as clawbacks or the difference between types of care?
The Honourable Tony Ryle.
I would say she's missed the point completely. The fact is that this is about providing better access for children under the age of 5 or 5 and under to after-hours GP care. It's a commitment that the government made before the last election, and it's a very good preventive measure that many people in the health service are welcoming.
The Honourable Marion Street.
Supplementary. Mr. Speaker, will free after-hours medical care for under-6s be available throughout New Zealand? And if so, how does he intend the service to be provided in rural areas where there is only one GP available?
The Honourable Tony Ryle.
Mr. Speaker, it is the government's intention that it should be available across New Zealand. We have to remember, though, this is not a compulsory scheme. We've had to negotiate this with individual after-hours centres and GP networks, and so those who don't want to participate, we can't force them to. But I think excellent progress is being made.
Question number 10, Claire Curran.